TMJ, TMD training, hands-on, so you can help your patients. I'm here with one of my awesome friends and sponsors who's going to share with us what she does here on Talking Nachos. On Talking Nachos, our goal is to help you increase success, decrease stress, and most of all, reduce the number of times you feel like crying inside a day. We've all had those TMJ patients that have made us want to cry inside. So share with us who you are and what you do to help dentists.
Yeah, wonderful. So my name is Priya Mistry, and I have a TMJ only practice. So very little sleep, no general dentistry, like TMJ only. And so to help dentists, what I've done is I've created a course that I'm teaching, a 2-day hands-on intensive course that I'll be doing a couple times a year. But my next one is in August of this year. And so I would love to teach dentists how to diagnose and treat TMJ successfully in their own practices because a lot of my patients travel from far distances to see me, and that really sucks for them.
Yeah, I love that. They can bring it to their own towns. Now,
Sure.
we talk about the impact we make on patients, which is important, but one of the dentists you've trained or someone who does this, what's the impact on their life? Do they enjoy dentistry more? Do this save their back a little bit from not
Mm.
having to do as many class twos on number 15? Tell us a little bit about that.
They save their back a lot bit because, yeah, and there's just no two ways about it. I mean, you're going to save your body, you're going to have a much longer career if you want it. So I think that's a huge plus with treating TMJ, TMD. And then it's also very gratifying to get people out of pain. They're
Yeah.
like, I've been to like 20 other places, I've spent this much money, I'm still in so much pain. And then when you're the one that's able to fix it, it's amazing, right?
I think you can, I mean, I'm sure this is cliche, has been used many times for people like you, but you're like TMJ House. Remember that show House?
Oh gosh,
You
yes.
you figure out the
I love
problem.
house.
The person goes in a lot of places. Well, now people can text TMJ to 215-543-6454. My grandmother was right. I am special because of me. You will save money. Dentists love saving money. Okay. But tell us just like they come to your office. I hear they leave with their own souvenir appliance. Tell us more about that.
Yes, yes. So they come to my office and we figure out first the severity, like how bad is the TMJ problem? Is it muscle only? Is it joint only? Is it muscle and joint? Is the disc displaced without reduction? Like what exactly is going on? And then based off that, we come up with their own like custom treatment plan. So for some people, many people, we make orthotics. So we're measuring where the muscles are most relaxed, where the joints are decompressed and aligned, and we're building a really specific prescription into the orthotics. So
Like,
many people leave with that. We also do disclusion time reduction therapy, so DTR therapy for the people who are not locked, for the people where it's mostly muscular and a little bit of joint. That actually works really well, but not everyone's a candidate for that. So those are like my two primary methods. I have laser therapy, hands-on therapy. There's a lot of different tools in our toolbox here.
I love it. I mean, dentists going to these small group C courses, you get to learn. You also get to develop new relationships. We just did one in Philadelphia on photography. I want to share. You also did an amazing webinar for our community. People can watch that free recording by texting TMJ to 215-543-6454. So I'm an expert in a few things. Priya, eating nachos, not making it to the NBA, but also in kindly annoying dentists. So let's say someone's watching us thinking, I don't even know if I want to do this. This isn't for me. I can just refer it out for the rest of my life. Why should they at least watch your webinar? Why should they at least
Oh
spend
yeah.
60 minutes so that they're a better dentist for their patients? Tell us.
Sure, sure. At least, well, first off, it's free. So
Yeah.
watch it, right? If it's free, take three. That's what they say. So watch it.
Yeah.
But after the webinar, I feel like you'll be able to better diagnose. Like
Yeah.
there's even some diagnosing in there. So if you can help a patient figure out what's wrong, and you're like the only one in town that's able to do that for them, or in even in the area,
Yeah.
um, that's going to stand out and that's going to spread with word of mouth and it's only going to help your practice. So even if you don't attend my in-person course, watch the webinar. There's no
Yeah,
reason not to.
you
You
get
can
to differentiate yourself as somebody
exactly,
who can solve problems that are not related to class twos and crowns. Those are important too. But
totally.
we've all had these patients who are just in agony. They can't find a solution. So use Dr. Priya and her teachings. Go to Washington, hang out with you. You're going to have a course come up in August, but you
Mhm.
also have other courses throughout the year.
Yeah, I'll have some. I won't have another one this year, but I'll have two that I'll set up for 2026. I just
All
haven't
right.
released the dates yet, but I want to. I'd love to release them a year in advance. So I need to do it soon.
All right, great. Well, we'll stay tuned for that. Thanks for supporting us as a sponsor. I watched your webinar. It was awesome. We
Oh,
really
thank you.
appreciate you sharing with us today.
Thank you for having me. I really appreciate Dental Nachos. You guys are amazing.